Dr. Russell Skinner is a medical expert, and this is, when I talk about conspiracies, I am 100,000 times in support of what I think he's going to say. Dr. Russell Skinner is a medical expert, and the question is, do over-the-counter cold medicines really work, or are we just victims of the establishment and the advertising world? Good morning, Doc. Thanks for coming on the radio.
Good morning.
Are we victims here?
I would give a PC answer and say that in some cases, maybe.
Yeah.
But in some cases, those medicines do actually work for people.
Dr. Skinner, we do not want PC answers.
Listen, I've always been...
We're talking about a study that just came out that said the active ingredient in most decongestants that are available now, phenylephrine, doesn't seem to have a benefit over placebo. And that's the actual ingredient that's in most of the stuff that you get there on the aisle at the store.
Doc,
and
what I find interesting is it may not help my cold, but it prevents me from urinating. Okay. So
I
you know what I'm saying? It does something. It just, I feel like not only now do I have a cold, but I have this terrible sensation to go to the bathroom and I can't go.
Yes.
Yeah.
Well, those products, both phenylephrine and the older form pseudoephedrine, both constricts smooth muscle. And so in your nose, when your smooth muscle constricts, it opens up your airways. However, in your prostate or other places, that smooth muscle constricts down and can cause problems. That's exactly the problem it causes. Now, my pharmacist told me when I because you got to give your license now and everything to get Sudafed. He said, you know what, I would recommend, he said, you're 50 years old, and you have high cholesterol, you're working on that problem, but I would not recommend Sudafed because he said it increases your heart rate. And the last thing you want to do is you never know when that could increase the heart rate and something could break loose and all of a sudden, it's just not good, not good for you. Do you agree with that? Yes, there are definitely people who have high blood pressure, people who have known coronary disease that should not take decongestants, whether that is Sudafed or even being very conservative, and even the phenylephrine products. That's correct.
I felt a cold coming on today, and I immediately thought of the zinc craze that we went through. Is there any study out there that is showing that really works?
There are some studies. Now, they are not what we would consider, double-blinded, placebo-controlled clinical trials and so forth for those. But most of those products do have some research and some studies behind them.
Yeah.
Zinc is one product. Your vitamin C's, lozenges, and things like that can offer some relief. The big thing behind that is that vitamin C and zinc are both crucial for proper immune function. And so, if you're deficient in those, then obviously taking a supplement can help your immune system function more properly.
Okay. Andrew.
So, Doctor, a lot of people say that to cure a cold or anything like that, you just got to drink plenty of fluids and get plenty of rest. Is that the true way to go?
For colds, any viral illness, there's not a cure for viral illnesses. There's not a cure for the cold. To an extent, they have to run their course and you treat symptomatically. The best way to be able to clear it most quickly is to make sure your immune system is strong. So
that's it.
Yeah. You're getting adequate rest, that you're adequately hydrated, that you're eating so you're getting nutrition to your body so that your immune system functions correctly, and that allows your body to fight off those viral infections faster and easier.
And really just the hydrating, that is just good for you to begin with. You should be drinking to the point that your body, I'm told, and correct me if I'm wrong, that looking at, I'm mentioning urination, but that you literally should really look at the color, and it should be a light yellow, and if it's not, you're either you're having too much water if it's completely clear, or not enough water if it's a darker color.
Generally, that's true. There's some other things that can affect urine color. Water-soluble vitamins, vitamin C's, and things like that do get excreted in the urine, and that can change urine color. Anybody that's taken a handful of vitamins in the morning, the first time they go urinate, it's bright
neon yellow.
That's a lot of those water-soluble vitamins being excreted. But generally, yes, you want nice dilute urine. And if you're consistently urinating and it's dark and appears concentrated, then it is. Yeah. And you're not adequately hydrated.
But that's deceptive, though.
Last question. At the end of the day, do we take these over-the-counter things or do we not?
At the end of the day, I'd say if you've taken them before and you get relief and they do help, then there's no reason not to.
Yeah.
However, if you're going there and you're taking it and it's not helping, and you're going back and buying box number 2 because you're convinced if you take it a little longer, it's probably not working for you.
All right. Dr. Russell Skinner, thank you for some normalcy this morning. I have no idea what we've dealt with the last 45 minutes. I appreciate your time.
You're welcome.
Okay.
Thank you.
All right. 8:27. We'll break here and come right back. It's First News Keeler in the morning. Free money question of the day from Hobica Law Firm coming up on WIBX.